Ventricular fibrillation, VF, is a life-threatening arrhythmia characterized by disorganized and ineffective heart contractions. This video will explore the complexities of VF, including its causes, symptoms, diagnosis, treatment, and potential complications. We will also discuss new developments in managing VF. Ventricular fibrillation, a life-threatening cardiac arrhythmia, is caused by disruptions in the heart's electrical system. This can happen due to issues with ion channels, resulting in re-entry circuits, abnormal automaticity, and triggered activity. These mechanisms lead to chaotic electrical activity in the ventricles during VF. During VF, the normally coordinated electrical signals in the heart become disorganized and asynchronous. This is due to alterations in the ion channels responsible for the generation and propagation of electrical impulses. Dysfunctional ion channels, such as sodium, potassium, and calcium channels, disrupt the normal depolarization and repolarization phases of cardiac cells. Additionally, abnormal refractory periods can occur, leading to the re-entry circuits mentioned earlier. Conduction abnormalities, including slowed or blocked conduction, further contribute to the development and perpetuation of VF. Numerous cardiac and non-cardiac conditions can predispose individuals to ventricular fibrillation. Chief among these are coronary artery disease and myocardial infarction, where impaired blood flow to the heart muscle can result in ischemia and subsequent arrhythmias. Congenital heart diseases, such as hypertrophic cardiomyopathy and long QT syndrome, can disrupt the heart's electrical activity and increase the risk of VF. Additionally, various structural abnormalities, such as valvular disorders and myocardial fibrosis, can create an arrhythmogenic substrate, increasing the likelihood of VF occurrence. Several risk factors contribute to the development of ventricular fibrillation. Advancing age is associated with increased fibrosis and alterations in ion channels, making older individuals more susceptible. Hypertension, diabetes, and smoking, due to their impact on blood vessels and the heart, create an environment conducive to arrhythmias such as VF. Furthermore, genetic predisposition plays a significant role, with certain inherited conditions increasing VF risk, including long QT syndrome, Brugada syndrome, and catecholaminergic polymorphic ventricular tachycardia. Recognition of ventricular fibrillation is crucial for timely intervention. VF typically presents with the sudden loss of consciousness and absence of a palpable pulse. Ventricular fibrillation is often associated with ventricular tachycardia, which may appear as an irregular, wide complex rhythm on an electrocardiogram, ECG, recording. Other signs may include chest discomfort, shortness of breath, and dizziness. Prompt recognition and initiation of life-saving measures are essential for improving patient outcomes. The diagnosis of ventricular fibrillation is primarily established through the analysis of ECG recordings. Ventricular fibrillation is characterized by the absence of regular RR intervals and the presence of irregular and erratic ventricular complexes. It is important to differentiate VF from other arrhythmias, such as ventricular tachycardia with pulse, VT, or supraventricular tachycardia with aberrant conduction. Non-cardiac causes of sudden collapse, such as seizures and hypoglycemia, should also be considered and excluded during the diagnostic process. In the management of ventricular fibrillation, prompt initiation of advanced life support measures is crucial. This includes immediate CPR, early defibrillation, antiarrhythmic drug administration, and post-resuscitation care to stabilize the heart's electrical activity and ensure adequate recovery. The prognostic outlook for individuals who have experienced ventricular fibrillation depends on various factors. Prompt resuscitation and the underlying cause significantly influence outcomes. Recurrence of ventricular fibrillation is a concern in those with predisposing conditions, necessitating comprehensive management and close monitoring. Cardiac arrest survivors often face potential complications, such as neurological deficits, heart failure, and post-cardiac arrest syndrome, which encompasses a systemic inflammatory response. Long-term multidisciplinary care and secondary prevention strategies are crucial to improve overall prognosis and minimize the risk of future adverse events. Ventricular tachycardia is a precursor to ventricular fibrillation, especially when it persists or occurs recurrently. Sustained ventricular tachycardia can lead to ventricular fibrillation through a phenomenon referred to as electrical storm. Electrical storm is characterized by multiple episodes of sustained ventricular tachycardia or VF within a short period, often necessitating immediate intervention. Understanding the triggers, risk factors, and management strategies for electrical storm is crucial in the overall management of ventricular arrhythmias and prevention of VF. In the section on pharmacological therapy for ventricular fibrillation, we explore the use of antiarrhythmic medications like amiodarone, lidocaine, and beta blockers. These drugs help stabilize cardiac electrical activity and reduce the likelihood of VF occurrence, with each drug having its own specific benefits in certain clinical situations. The selection and dosing of these medications depend on various factors like the patient's presentation and medical history. ICDs have transformed the treatment of ventricular fibrillation. They detect and deliver electrical shocks to rapidly and effectively restore normal heart rhythm. ICDs are recommended for high-risk patients with a history of VF or life-threatening ventricular arrhythmias, and those at risk of sudden cardiac death. In the video, we will discuss the latest advances in treating ventricular fibrillation, VF, a life-threatening heart rhythm disorder. These include optimizing defibrillation waveforms, targeted electrical mapping, and gene therapy techniques to improve outcomes and patient care in VF management. Ventricular fibrillation is a serious heart problem that can be deadly. Learning about its causes, symptoms, detection, treatment, and new therapies is crucial for healthcare providers in order to improve patient outcomes and reduce sudden cardiac death.